Thank you all, and thank you very much for inviting me to speak on behalf of Unite. I'm really happy to be here and happy, that's better, I'm a very small person, and happy to be a big supporter of health campaigns together. Hopefully many of you will know Unite, and thank you for the applause, but just to give you a brief outline, we are the largest public and private sector union in the UK. We cover people working in 20 employment sectors, from aerospace to civil aviation to passenger services, finance, manufacturing, health, retail, services. In fact, health is our largest sector. You name a place that somebody works and Unite will be there. We are rightly proud of our tradition of being a fighting back union, fighting back against unscrupulous employers to protect and defend jobs, terms and conditions, but not just that, to defend our public services on a wide variety of social and political issues affecting our members, their families and their friends and their communities. We campaign on jobs, on housing, equality and employment rights because all of these things are linked. We've been fighting back despite the government introducing the Trade Union Act this year to cap and control our members' rights to take industrial action in support of their working conditions. And despite that, we have managed to continue to have successful strikes. So we have had successful strikes this year in British Airways Mixed Fleet, the Bank of England, Woolwich Ferry, Barts Health, Serco Facilities Management Contract, to name a few that have taken place and have resulted in wins for our members. We are all facing difficult times: Brexit, continued austerity, slow economic growth, attacks on our public services. As a trade union, it can be hard to work out where to focus your energies because there are so many things we need to campaign about and fight on. And working in the health sector is a challenge for trade unions. There has been constant change, and the service, as many have already said, is under the most enormous strain it may ever have faced, and has been purposefully deprived of funding needed to provide a service to meet growing demand. Our members always put patients first, and in all that they do, but they are stressed, they are anxious, and they are continually concerned that because of the continuous squeeze on finances and the endless drive for efficiency savings, they are being forced to work unsafely and in contravention of their codes of practice for their profession, to reach unreasonable targets, take less breaks, work longer for no recompense. We have horrendous stories of our members having to use, despite the fact they are in work, food banks, of being worried about whether they can stay in work because can they keep their heads above the water financially? Can they afford to pay for Christmas this year? We are fighting back to protect health visiting services, where the commissioning of these services has now moved to local authorities who have no money and is regularly resulting in reorganisations, downbanding and the de-skilling of our workforce, and these are the staff at the forefront of protecting our children. We are fighting back to protect mental health services. I read on Twitter the other day that on one specific day last week there was not one mental health bed available in the country. This is 2017. This cannot go on. 1 in 5 mental health beds have closed since 2010, at a time when young people are more and more subject to mental health issues in greater and greater numbers. We are campaigning against STPs, as we call it, slash, trash and privatise. These are supposedly the holy grail to resolve the issue of health and social care, but there have been holy grails before. And this is predicated on 22 billion worth of cuts and savings in services that have already been cut to the bone. No one would object to the principles of bringing health and social care together. They are intrinsically linked. But this is where is the funding and the investment in the community, in our public health services, or in social care? This feels like an administrative exercise with little clinical basis, little engagement with local authorities, and where financial savings appear to be more important than high quality health care. So what can we do? We can combine our resources and work more together. At Unite, we have always done this and recognise that we have more in common together than we have apart. And we need to think outside the box to do that. We have always looked to combine our work to organise and represent workers alongside an agenda to campaign and protect and defend services. We have always developed excellent working relationships with campaign organisations, both at a local level and a national level. And we have been part of helping develop and supporting health campaigns together from the beginning, and have worked with Keep Our NHS Public both nationally and locally, supported many local campaigns, Lewisham, Epsom, St Helier, Charing Cross and Ealing, to name a few. But often staff feel afraid to raise publicly their concerns about what's happening with their services, and that's where the union can do this. We can do that on their behalf, and we can liaise with local campaigns to give them the information and resources they need to campaign locally and politically. We can use our resources, our campaigns and communications department, our social media, our political engagement, our sectors, our members working outside of health to raise the information and to support local campaigns. Some examples of where we've done this is our community branches. We now have a number of community branches across the country. These are people who are not in work at the moment, but come together, supported and funded by Unite, to campaign on issues of importance to them. And that means that they've been engaging with our industrial campaigns, getting out on our picket lines, or standing outside Sports Direct, deploring the abhorrent employment practices there. Our retired members branches, members who've worked and are in Unite who are now retired, they are also very active. You may also be aware of the People's Inquiry into London's NHS, which Unite London Eastern Region sponsored a couple of years ago. John was very much involved with that, and Louise. Well, we had a panel of health service workers, campaigners, journalists, where we gathered evidence from a wide variety of sources, including health service workers, managers, leaders, economists, doctors, campaigners, and professional bodies. Exercises like this show how trade unions can use their expertise and resources to widen out the campaign work. It makes no sense when we all have so much to do, to say, and to fight for, to not be working together to build our strength and our effectiveness. We regularly encourage our local branches to affiliate to KNOP, and we try and spread the word of the work that Health Campaign Together is doing across all of our sectors through our industrial networks. We believe we all need to work together to build strength, share our knowledge and resources, and be more effective. Unite alongside other... Yep, I'm nearly done. Unite alongside other health unions has this year, for the first time ever, put in a joint pay claim to the pay review body. And we will be wanting your support, as Sarah Gordon said this morning, in running that campaign. And for Unite, we're calling it It's About Respect campaign. And we say, it's about respect. Don't drive our health sector workers to their knees. It's about respect. Pay workers fairly and end pay restraint. It's about respect. Treat health workers and patients with respect and dignity. It's about respect. Stop running our NHS into the ground and making out the only solution is privatisation. It's about respect, making the NHS all about high quality care and not unachievable savings. It's about respect. Fund our NHS to meet demand. Thank you.